Hello everyone, my name is Manisha Negi. Welcome to today's in service where I'll be discussing about different health disadvantages experienced by Aboriginal and Torres Strait Islander people in Australia. As you can see on the screen, life expectancy, lack of culturally safe practice, limited access to healthcare due to location, lack of communication skills are some of the health disadvantages experienced by Aboriginal and Torres Strait Islander people in Australia. I will be further explaining these points. The colonization process has led to the estrangement of Australian Indigenous people from their country and resources, as well as the disruption or loss of their language, ceremonies, rituals, kingship, and family bonds and health. On average, Indigenous people of Australia have a life expectancy that is around 10 years lower than that of the general population in Australia. Furthermore, compared to non Indigenous people are at greater risk of experiencing chronic illnesses, psychological issues, and ear problems. First Nations people have less access to healthcare due to geographical isolation, lack of cultural sensitivity, and affordability. Lack of culturally safe practices and effective communication are other important health disparities experienced by Australian Indigenous people. First, Australian possesses a holistic perspective on health encompassing physical well being, spiritual fulfillment, familial connection, and communal involvement. Professionals and patients with different cultural and linguistic backgrounds have trouble communicating, which resulting in the people leaving the hospital against medical advice, death, lack of hospital stays or long stays, and distrust of healthcare providers. Among Now I'll be discussing about racism, which is one of the health disadvantages experienced by Aboriginal and Torres Strait Islander people in Australia, and how racism is acting as a barrier to achieve equitable health outcomes. Racism is a complex phenomenon that arises from the combination of prejudice and power extending beyond the individual cognitive processes of forming racial stereotypes. I want to discuss case study where racism led to the death of 27-year-old Naomi Williams, an Aboriginal woman from the Wiradjuri Nation who was also 6 months pregnant with her first child in 2016. Naomi presented with nausea, vomiting, abdominal pain, and dehydration. The nurse assumption of Naomi being drug seeking and her lying about the pain, no attempt at a physical assessment on her, ignoring signs of pregnancy and septicemia, and sending her home after just administering paracetamol were just clear sign of racism, which resulted in the death of 6 months pregnant Naomi. Naomi made 18 visits to the local hospital before her death but still was misdiagnosed. Before her death, she expressed to her family that how she was ignored and treated like a junkie during her hospital visit. Therefore, the health seeking behaviors of Aboriginal and Torres Strait Islander people have been impacted by practitioner and medical professional that reflect racial biases. Now I'll be explaining how we as a nurse can address racism experienced by indigenous people and our role. Nurses play an important role in addressing issues like racism in healthcare experienced by Aboriginal and Torres Islander people in Australia. Racial discrimination within the healthcare industry hinders the fair provision of services, leads to inferior health results and negatively impacts Aboriginal and Indigenous people. To deliver culturally safe practices, nurses can benefit from the knowledge they receive about Aboriginal history, health, and cultures through programs. This makes nurses aware of the detrimental effects of racism, prejudices, and misconceptions on the current health conditions of Indigenous Australians. According to Nursing and Midwifery Board of Australia, Code of Conduct 3.1, nurses must provide inclusive care that is impartial, free from racism, challenges, presumption rooted in beliefs, and is culturally safe and respectful towards Aboriginal and Torres Strait Islander communities. In previous discussion, we examined the case study of Naomi, where nurses' presumption about her drug-seeking behavior and failure to adhere to the Code of Conduct 3.1 resulted in the death of Naomi and her unborn child. When it comes to ensuring that Indigenous people adhere to the healthcare and are satisfied with it, the incorporation of mental health specialists who are culturally sensitive could be an essential step. Effective communication between nurses and Australian Indigenous ensures quality and culturally safe practices. Code of Conduct 3.3 explains that when communicating with patients or their families, nurses should do their best to accommodate their unique linguistic, cultural, and communication requirements. This may include making use of translation or interpreting services as needed. Nurses plays a pivotal role in healthcare reform and social transformation through culturally informed critical reflection, power awareness, collaborative outcome negotiating with patients and their families, and understanding of the complex interplay between health, politics, and nursing practices. Lastly, I will be explaining about the strategies that can be implemented in workplace where racism is experienced by Australian Indigenous people. Firstly, I'll be discussing the importance of attending training on how to provide care for Aboriginal and Torres Strait Islander people, which is culturally safe and respectful. Such training educates nurses to understand cultural and history and reduces the racial bias towards First Nation people, facilitating collaboration and active involvement between healthcare professionals and Australian Indigenous individuals is an additional approach employed to mitigate instances of racism within the workplace. They can collaborate to formulate policies and initiatives that can lead to improved health outcomes. Addressing institutional racism is crucial and can be achieved by reviewing comprehensive policies to provide equal health treatment to Aboriginal and Indigenous people. Institutional racism refers to the cumulative effect and accumulation of biased attitudes inside the culture and practices of organization as well as the underlying structural process and agendas. Mandatory reporting and monitoring and of any form of racism towards any patient can act as an essential strategy to address racism. Establishment of multidisciplinary teams, which includes the Aboriginal Torres Islander workforce, can contribute to providing culturally safe practices and improving health outcomes. Through health promotions, decisions, research initiatives, and respect for holistic cultural values of health and well being, Aboriginal communities can develop collective psychosocial stress, coping strategies, and a sense of self worth and personal control.